Namaste. Welcome to the video on clinical presentations and laboratory diagnosis of diabetes mellitus. I am Dr Mahesh Hirulal, Associate Professor, STM College of Ayurveda, Hassan. Diabetes mellitus is an important condition in India due to its increasing scenario. India is called as capital of diabetes. Diabetes mellitus, commonly known as diabetes, is a metabolic disorder characterized by high blood glucose level over prolonged period of time. Before going to discuss about diabetes mellitus, we will discuss about glucose metabolism. Carbohydrate is a major source of glucose. The carbohydrate digestion and the absorption will take place in the GI. From the GI, it is absorbed and it is reaches to the liver. From the liver, it will reach to the systemic circulation, and from the systemic circulation, the glucose will reach to all the tissues of the body. The excessive glucose will be stored as glycogen in the liver and in the muscle. Insulin is produced from beta cells of isolate of Langerhans in pancreas. It will help the tissues to absorb the glucose from the systemic circulation and utilize the glucose for the production of the energy synthesis, that is the production of ATPs. Common clinical presentations of diabetes are polyuria, increased urination, polydipsia, increased thirst, polyphagia, increased hunger. These are called as 3P of diabetes mellitus. The diabetic patients may present with balanitis in males, pruritus vulvae in females. Slow healing ulcers and frequent infections are the most important clinical presentation of diabetes mellitus. Most of the times, diabetic patients will present with the general and very vague symptoms like weight loss, lassitude, weakness, exhaustion, and lethargy. The types of diabetes mellitus are type 1 diabetes, which is also called as insulin dependent diabetes mellitus or juvenile diabetes. Type 2 diabetes is also called as non-insulin dependent diabetes or adult onset diabetes. The third one is gestational diabetes. The fourth one is diabetes due to other specific causes. In type 1 diabetes, there will be destruction of pancreatic cells which will lead for insufficient insulin. When there is an insufficient insulin, the optimum level of glucose will not be used for metabolism, leading for increase in blood glucose level. In type 2 diabetes, there will be inefficient insulin and there will be the insulin resistance is seen in type 2 pathology, which will lead for the increased glucose level in the blood. Routinely advised laboratory investigations in diabetes mellitus are test for glucose in urine, blood glucose level tests like FBS, PPBS and RBS, OGTT and HbA1c. Test for glucose in urine is not a confirmatory diagnostic test for diabetes mellitus. It is used to detect the glycosuria. Glycosuria is a condition where the glucose will appear in the urine. The glucose will appear in the urine when plasma glucose concentration exceeds the renal threshold value, that is about 180 mg per dl. Glucose in the urine can be detected by Benedict reagent test. Benedict reagent test is became almost outdated in present day. In present day, in the laboratory, the urine dipstick method is used to detect the glucose in the urine. Blood glucose estimation is the most important, common, and routinely used investigation to diagnose the diabetes. Blood glucose level can be estimated at different time frames of the day. Random blood sugar can be done at any point of the day, and the normal range for RBS is 60 to 140 mg per dl. Fasting blood sugar has to be done preferably in the morning. Patient is instructed for 8 to 10 hours of fasting. FBS normal range is 60 to 110 mg per dl. Postprandial blood sugar PPBS has to be estimated about 2 hours after the meal. Normal range for PPBS is 80 to 140 mg per dl. Oral glucose tolerance test OGTT is a special test where the patient's response to oral glucose load is estimated. Patient is asked to take about 75 gram of glucose in 300 ml of water within 5 minutes. Then the glucose level is measured for every 30 minutes for 2 hours. This test is especially used to diagnose the gestational diabetes. HbA1c is also called as glycated hemoglobin is the most important test to diagnose the diabetes mellitus. It is also used to monitor the blood glucose control and to see the treatment response. The HbA1c will give the average blood glucose level of 2 to 3 months duration. The reference ranges for HbA1c is 4 to 5.6 percentage is a non-diabetic, 5.7 to 6.4 is pre-diabetic stage. If a patient is already diagnosed with diabetes mellitus and if HbA1c shows 5.7 to 7.4 percentage, then the diabetes is under good control. If it is ranging between 7.5 to 8.4, then diabetes is under fairly control. If it is more than 8.5 percentage, then the diabetes is under poor control. With the value of HbA1c, we can also calculate the average blood glucose level for 3 months. With signs and symptoms of diabetes mellitus, laboratory investigations will play the vital role in finalizing the diagnosis of diabetes mellitus. Laboratory criteria for diagnosis of diabetes mellitus is HbA1c more or equal to 6.5 percentage, or if FBS is more than 126 mg per dl, or RBS is more than 200 mg per dl, or second hour plasma glucose level is more than 200 mg per dl in OGTT, then patient can be diagnosed with diabetes mellitus. Some additional tests can be done in diabetes mellitus. C-peptide is a test to differentiate the type 1 and type 2 diabetes. The autoantibodies can be examined to confirm the type 1 diabetes. Urine for ketone bodies and albumin can be examined to make the diagnosis of complication of diabetes mellitus. Lipid profile can be estimated to evaluate the association of dyslipidemia with diabetes mellitus. C-peptide is a byproduct of insulin production. In the process of cleavage of proinsulin into insulin, the C-peptide is released. The clinical significance of C-peptide is in type 1 diabetes, the C-peptide may be low or it is undetectable. In type 2 diabetes, the C-peptide level may be normal or sometimes it will be elevated. Most of the times, diabetes mellitus patient may present with its complications. The investigations like ketone bodies, electrolytes, blood gases, and pH has to be investigated in diabetes mellitus acute complications like diabetic ketoacidosis and hyperglycemic state. The diabetes mellitus may lead for the chronic complications like microangiopathies. Some of the microangiopathies are diabetic nephropathy, diabetic neuropathy, diabetic retinopathy, and erectile dysfunction. Diabetes mellitus in chronic will also lead for the macrovascular complications like coronary artery diseases, peripheral vascular disease, and diabetic myonecrosis. There are different laboratory and imaging techniques are used to make the diagnosis of complications of diabetes mellitus, which are most important in treating the complications of diabetes mellitus. The detailed pathophysiology investigations in complications of diabetes mellitus will be discussed in further videos. You can watch the previous videos on interpretation on RBC, WBC, and platelet studies in CBC, and video on interpretation on liver function tests. In next video, we will discuss on renal function tests. Kindly like, comment, share, and subscribe to the channel. Thank you for watching this video.